Hello everyone, I'm Taerim from Korea National Open University. I'm very happy to give a talk in front of the caucus of women in statistics, and especially in the conference of International Day for Women in Statistics and Data Science. Today's my topic is a prognosis of COVID-19 patients by the underlying disease and drug treatment in Korea. Recently in Korea, there is a report of the lesson from South Korea about COVID-19 in viewpoint of the environmental and also epidemiological viewpoint. So there are many the experience we have and data also we have. So the outline of my presentation is first motivation and background review and a patient and data and model, and finally conclusion. The first motivation for me is underlying disease, diabetes mellitus and hypertension, a risk factor for the severity and mortality of COVID-19 patients. Second motivation is some drugs we call the ACEI drug and the ARBS are the controversial role in a process of COVID data patient's case. So the focusing on the two underlying disease, and also two drugs is influenced to the mortality and also severity of the COVID-19 patients. So recently another report is COVID-19 in South Korea, viewpoint of epidemiological and spatio-temporal pattern of the spread and role of aggressive diagnostic test. We have many testing the place here. So in early phase, we very sensitive to the how many diagnostic tests and how many incidence patients, So this graph shows us the first case in the Korea Daegu area. And after the 2 months later, we have, the high-level social distance recommendation. So we're focusing on the very crowded situation, like a church or like a big auditorium meeting. And so that is our data come from there, how many COVID the patients come from that kinds of situation there. And also from people come from abroad, we regulated 14 days quarantine, separation from the family and all overseas arrivals. So it is not convenient, but we have to do that. And this graph shows the epidemiologic aspect of Korea, COVID-19 in Daegu, and daily series of cumulative confirmed case, that is a very increasing like here. And daily series of confirmed case after with imported case is a red dot here, red. And also this is not a cumulative, but daily we reported to the instance of COVID-19 here. And also the geographically first outbreak in the Daegu and the pink area. After that is spread whole the neighbor city there. So we, according to the blue color, the clear in dark blue or light blue, that is how the patient's instance account different, So also this is a estimated logistic growth curve. So we can have, there is a peak point here, and also there is a plateau point here. So that is we can analyze how many duration we have a peak point meet, and also plateau point to be meet. So that is very important information for us. And also left graph is a time varying production number we call RT. So in COVID data analysis, RT is very important index reproduction number. Every day we can compare how improved this reproduction number. And also there is like a peak and the plateau like here, and also time-varying epidemiology doubling time. 7-day rolling estimate was applied here, and it's a doubling time is a peak and the pledge here also. And also this table shows us the epidemiological baseline information of the COVID-19 patients. So we have a peak like here, and also the area, and also the age group, and also gender. We have these kinds of data, RT and doubling, and all the statistics calculated by the Korean FDA there. CDC, Korean CDC there. And also this graph, we separate according to the area. We can have a logistic growth curve here, and also the time varying reproduction number, RT, like here. And also second part is the age group. According to the age group, different curve we can get, and also according to the age group, we can have different time varying reproduction number trend. And also gender, and so you can compare between the male and female, and age group, young and the old age group there. So that is also basic. And also this graph gives us a very important information. Green curve is a number of the diagnostic test. We have a very many places. There is a COVID PCR, and we can take a test. I have already 3 times in Europe too, and almost 5 or 6 times PCR test. And according to the test number, the green color is the number of new patients, and the pink color is the number of diagnostic tests. So diagnostic test graph is more bigger and higher. The new confirmed COVID patients number is decreased like here. So it is very important information for us too. And also, we have a change in the newly confirmed case per 1,000 tests, the 1,000 prognostic test, PCR test, we can have these kinds of, data. RT is, this is RT, this is a number of tests, number of tests more bigger and bigger, the RT is lower and lower here. And also leg day is graph 3, 7-day moving average number of tests. And also we have, these kinds of a graph. We have a time varying, And these are 7-day rolling association. That is our baseline statistic before in the table. So we make a more easy understand to like a visual graph here. And also, this bar chart is, the daily death account by the COVID-19 patients, So we have these kinds of data. And also the daily percentage of new deaths compared with the number of cumulative confirmed case. That is more decreased like here, And also according to the area, we can have these kinds of different box graph here. So we can compare these kinds of various kinds of stratification or various kinds of covariate. We can compare this phenomenon here. And also the Kaplan-Meier analysis of a survivor according to the patient's characteristics and condition. It means that the baseline disease they have or not, or our focus in the 2 drugs they have or not, take or not. So also the SES is a socioeconomic status according to the status, different phenomenon they have, survival, like here. And also it has been reported that both 2 drugs, ACEI and ARBS, can significantly increase the messenger RNA expression of cardiac angiotensin enzyme here. Based on this evidence, we have been hypothesized this drug may play a COVID disease severity, So the reason why we have a motivation of these 2 drugs intake. So we have this effect of underlying condition. It means that drug two drugs they take or not. And also these kinds of disease, cancer and cerebrovascular disease and heart failure and the mental disorder, these kinds of baseline disease, how they have risk. We can have compare various kinds of disease, baseline disease. And also we divide by the various kinds of baseline disease. We adjust that variable and we can compare these kinds of results. So effect of the underlying disease, whether they take ACEI and ARBS in past or present on hospital day. So we can have a subgroup data analysis. We can have diabetes mellitus and hypertension, how they different, According to the 9 kinds of model, we can have, for example, model 0 is adjusted covariate age, sex, and insurance type. Model 1 is plus together with the ischemic heart disease adjusted. So we can have a different shape, very almost similar but a little different, So we can compare all kinds of different situations, how the diabetes mellitus and hypertension affect to the severity of the COVID-19 there. So also the effect of the Charlson Comorbidity Index, we call CCI, and plus not taking or not ACEI, ARBS, two drugs, we can compare this one and like this, So we can compare every graph, we adjust by the basic covariates and we adjust another one. We can have a subgroup analysis. So this kinds of age and CCI and male, we can have a different result here. So there is a different model, we call that, So we have like these results. So another aspect viewpoint for the analysis of COVID-19, graphical change of air pollution before and after COVID-19. So it is a kind of, the topic is COVID-19 pandemic and environmental pollution, air pollution, and it is a blessing in disguise, COVID-19 make our daily life very inconvenient, a reduction in industry. So many influence to our daily life and society. But another aspect in the air pollution viewpoint, that is a very blessing, So let me check in China, before the COVID-19, that is like this, air pollution very severe. And after the COVID-19, very clear. And also in Spain too, there is this part is a severe air pollution, but after the COVID-19, that is very clear, And then France too, like this, and very clear, better than before. And also Italy, also like here, and Eastern U.S. also, we can clearly compare between the before and after COVID-19. So COVID-19 lockdown caused global air pollution decline. So we call that the global response to the COVID-19 pandemic has resulted in an unprecedented reduction in economic activity. We find that these kinds of society change, reduction the pollution-weighted concentration of nitrogen, NO2, is decreased, and also the increase of the ozone, O3, and also level of this NO2, 60 and 31% decreased in the 34 countries, So we can, by the data, we can compare, and also before graph, geographically, we clearly recognize that, So this is a kind of a transportation sector emission are largely responsible for the production of the NO2 anomalies, So we also, the NO2 is decreased and ozone O3 is increased, We can compare this geographical map here. And also short-term and long-term health impact of air pollution reduction from COVID-19 lockdown in China and Europe was reported in the paper. Like here, we can compare by the map. And also, the P-score we define like here. So the average death period before COVID, and also death from after the COVID-19 minus average before COVID-19. So we can P-score make like this graph. According to the country, Brazil and Japan and US and South Korea and United Kingdom, there is a different trend we can compare like here. So according to the incidence of the COVID-19 and the number of incidents, there is a different phenomena. But we generally we can compare the before and after. The deaths and mortality was different. The trend we can recognize here. And also, we can use the National Cancer for Health statistics like here. The yellow line is ordinary borderline here. But the corona season here, we can have some more higher mortality here, number of deaths, So we can more clearly compare like this graph, So this part is by the COVID-19 make up more number of the deaths, So we can weekly number of deaths we can compare like here. So the aim of our study is to investigate whether underlying disease and take ACEI and ARBS drug intake or not, and affect the duration of hospitalization and also mortality in patients. So in patients means they confirmed COVID-19. So data analysis come from confirmed COVID-19 data, and we focusing on the underlying disease, diabetes mellitus and hypertension, and also ACEI and ARBS, 2 drugs. So patients' data come from the Corona-19 International Cooperation Research Project data. So it was hosted by the Ministry of Health and Welfare of the Republic of Korea, and also Health Insurance Intensive Assessment Service that hosted the project, and we can get data from that project. This study used a National Health Insurance System claim database. From 3 years before the data, each patient's diagnosed with the COVID-19 to the 2020 of May. So that duration, we can focusing on the COVID-19, the patients, we can analyze 2 points. Baseline disease effect for their mortality and severity. And another second point is 2 drugs they take or not, according to the take or not, the severity and mortality influenced or not. So we fitting the model of the Cox proportional hazard regression model was used, and effect of drug was investigated. 2 drugs was prescribed or not during hospital day and after confirmed COVID-19. And also patient has a treatment ventilator, a good ventilator condition or the poor ventilator condition. And also Charlson Comorbidity Index is a CCI index, we call that, was considered. And we also conduct a subgroup analysis for each group according to the disease severity. And groups were also classified based on the specific drug treatment, 2 drugs intake or not. And also finally, we use the insurance type for the detect of the socio-economic status by the insurance type. So those kinds of covariate is our forecasting and the data analysis for the COVID-19 patients' data analysis. And this table shows the social demographic and clinical baseline information here. So number of patients data is 7,590 COVID patients. And also by the age and gender, age group, and social economic status and baseline disease. And it's also baseline disease here, and also ICU ventilator is good or not condition, and another baseline disease here. And also the hospitalization duration, we divide a subgroup, and also length of ICU, it is also very important for the patients condition there, and also the these kinds of medical treatments they had or not. So this figure shows us the effect of underlying conditions on mortality among COVID-19 patients. So ACEI and ARBS risk is like here, and also the cancer and cerebrovascular disease and heart failure and mental disorder according to the baseline disease. There is a different risk here, we can compare. And also effect of treatment on mortality for hospitalization. So it is in model 1, we can adjust the baseline covariate, and we can compare their mortality, and hospitalization and these kinds of medical treatments. We can compare the this risk and confidence interval like here. And also all the age, gender, and basic these kinds of the covariate, we can divide the subgroup. And we can get these kinds of statistics, and we can make a graph like here. So according to the model 1, for example, model 0, adjusted covariate age, gender, and insurance type. And model 1 is adjusted this plus ischemic heart disease by the adjusted, So we focusing on the diabetes mellitus and hypertension, how the difference between this in the model 0 in case and also model 1. So after the ischemic heart disease adjusted, we can compare this before and after and the other situation there. And also this graph also effect of Charlson Comorbidity Index, we call the CCI index, and whether not taking or not 2 drugs in the past and present hospital day. So we can analyze the subgroup analysis, but condition is CCI index considered, and also 2 drugs intake or not considered. So we can compare all this situation like here. And these kinds of analysis make us, we can get this final result and conclusion. So underlying disease, such as diabetes and hypertension and cancer, chronic kidney disease and heart failure and mental disorder, increase mortality. That is very important. And second one is, it is controversial whether these 2 drugs would benefit, improve COVID-19 patients. But in our study, patients taking this had a higher risk of mortality. It is a different, very, very important information for us. And also underlying disease affecting hospital day. More longer hospital day, So sometimes it is. We divided the medical aid group and lower socioeconomic group and the situation and higher socioeconomic situation. We make a subgroup and we can compare. So according to the situation, different results we have. So and also in addition, higher the comorbidity disease index with CCI index, the longer hospital day. That is our results. So these kinds of information we can get during the COVID very onset to the almost 3 years data, we can get these kinds of conclusion there. Thank you for your attention. And let me show. So I'm very happy again finish my presentation. And in the future, I hope we have a very close friendship and networking among the members of Caucus on Women in Statistics and Data Science. So in the future, we have a more many meeting and more we have a more the networking together. Yeah. Thank you.